I mean, this paper was in the first 80 people that were braced. So it isn't an overly large number, but one of the strengths is that it was every one of the first 80 that were braced consented to take part. So there isn't any missing patient data there. So using the same criteria that we used for that earlier study in the canoe trial, where I said at least 1 in 3 had a healed ACL with rehab and no brace. So that same criteria, which is that the ligament's continuous on MRI. So it was ruptured at baseline, discontinuous, and then it's continuous fibers. There's some variability in terms of how that looks, and we can, again, maybe get into that in a little bit, but I just want to say what I mean by healing initially is continuous fibers. So using that definition, 90% had ACL healing on MRI at 3 months after injury. So at the straight after the brace came off, 3 months time point, 90% had ACL healing. Within that 90%, it was a 50-50 split between what we call a grade 1 heel or a grade 2 heel. So grade 1 being continuous fibers but a bit thicker on MRI, and at grade 2, continuous fibers but it could be a bit thinned or it could be elongated or have a little bit of a sag. So we can talk about how they may function a little differently a bit later, but yeah, the main finding was that firstly 90% had signs of ACL healing. So we then compared 12-month patient-reported outcomes as well as other outcomes like return to sport and knee laxity on a Lockman's and pivot shift. And we compared that between those with a grade 1 heel, so continuous but thickened, versus either a grade 2 heel or no heel. And the reason we combined those two groups was because very few people had no heel. So there wasn't a large number there. And actually the majority who had a no heel actually had fused to the PCL or they'd fused to the lateral wall. So that could also provide a degree of knee stability. We're not quite sure. Anyway, so comparing those two groups, so let's call it a more healing or less healing, or a more favorable heel versus a less favorable heel, or a more normal looking ACL on MRI versus a less normal looking, whatever you want to call it. So we found that the better heels did better in terms of knee function on the Lisham scale, in terms of quality of life at 12 months. On the Lockmans, everyone had a normal Lockmans test compared to their opposite knee, and 92% had already returned to sport by 12 months. So that's better than the other group, but it's important to note that the other group also did quite well on average. So those numbers are more, seem to be better or comparable with what we normally see after ACL surgery. So although their knee function scores were worse, they were still a median 94 out of 100, 100 being the best possible, whereas the higher heel was 98 out of 100. So they're both kind of good scores here. 62% had returned to sport with less healing, which is comparable with what we usually see after ACL surgery. So the message there is a lot of people experience some ACL healing. Higher grades of ACL healing were doing really, really well, but also the lower grades appear to be doing quite well, possibly comparable to surgery. I think that's the main takeaway.